It's really interesting the people that you meet when you start following different people. Other people start popping up in your page or on your feed, and you are connected with other like-minded people. And my guest today, Dr. Amber Belt, is one of those people. I actually had no idea that she was following me, but when I looked at her account and what she was educating on, I thought anyone that calls the allopathic sick or system, right, what we all know here in America, as medicine, if they call it the sick care system, they are my people. Okay. And, honestly, even before 2020, guys, like I had very little knowledge of what a naturopathic doctor is. But Dr. Amber Belt has been practicing for almost 20 years. And she has been independent minded and reluctant to be part of the sick care system. She understands the struggles and the pitfalls and also the successes, because we all do know that there is a time and place for Western medicine. But when I heard her speak on concussions and treatments of that, as well as rice, I don't know if you guys know that, but it's rest, ice, compression, elevation. And that is something that I still tell people to do. Even with my own son, who's 14 years old, I'm saying we got to, compress it. We got to wrap it. We got to put ice on it, take some ibuprofen to stop the inflammation. And we're going to talk about those things here today. And I'm really excited to bring you some new education that I found, because certainly my practice will be different because of it. So welcome, Dr. Bell. Thank you for joining us here on Nurses Out Loud.
Yes, thank you for having me. I'm really excited to have this conversation today.
Yeah, you know what? So I'll let you take the lead. Where do you want to start?
We can start with rice if you want. That's a big one that's really hard to, even for me, who I've been preaching it for years, not to use rice. Mm-hmm. And even for me, when someone gets hurt, it's hard not to hand them the ice pack and say, put this on it. It's just it's so ingrained, right?
It is. I will say this, that my son's assistant basketball coach, he just finished his schooling for physical therapy. So now he's a physical therapist. And when my son twisted his ankle during the game, he said, no, we're not doing those things. And I thought, well, what do you mean? And yeah. I never, continued to talk. I mean, I talked to him a little bit about it, but still, like you said, it's really hard not to hand someone the ice pack.
Yeah. And I think part of that is, in that moment, we just want to do something to help. Yeah. We're helpers, right? Like you want to do something. But if you remember way back to physiology, when you're learning about wound healing and all of that, that first phase of healing is that inflammatory phase. Mm-hmm. And when we're thinking about healing a sprain or a strain and that collagen healing, that inflammatory phase being able to really do its job is it's essential to having that ankle or knee or whatever heal correctly. And that's where we kind of come in with rice and NSAID, so our ibuprofen or naproxen or whatever, and we put the brakes on that healing process. So I always try to, it's hard to get people to not do that, but
yeah.
but I try to, yeah.
Even the Tylenol. I didn't know that it destroyed glutathione, and I didn't know what glutathione did. But every time somebody's in pain, or a slight fever, right? A slight fever. Doctors and nurses are so, ready to just say, here, stop the fever, stop that from happening. When, and in reality, we should not be doing that. It's almost like telling our army to stop fighting. Is that correct?
Yeah, that's true. That's such a good way to put it. Yeah. And it's the same when we're talking about a musculoskeletal injury. It's the same idea with a fever. We need that immune inflammatory response to come in and start to immediately help that, that collagen start to repair itself, and we stop it. And I think that's why people, you hurt your ankle in high school and then the rest of your life it's your bad ankle. I think that's part of the reason why is we just don't allow it. We don't allow it to heal correctly.
Well, okay, so let's talk about the inflammatory process then.
Yeah.
What is it intended to do?
So basically, it's a call to your immune system to send in cytokines and growth factors. And, you're going to get white blood cells that come in and get into the mix. And they start over time because you got the inflammatory and then the remodeling phase and then the proliferative phase. And so it takes an injury. I mean, it can take up to a year to really heal it. I mean, but we want to encourage, or it's, that whole process is designed to help, lay down new collagen fibers in an organized way. So that ligament or that tendon or whatever can heal in a way that's organized and strong and pain-free.
Okay. Well, that makes sense. I mean, I do remember learning about the different phases of healing. And, and I wanted to be clear too. Well, let me ask you this. We talk about the different diseases in the body, and at the root of all disease is inflammation. And if we can stop the inflammation, then that is where, somebody can heal quicker. So let's just compare this inflammation, because I believe that we're talking about apples and oranges here. And the fact, what I'm about to bring up, apples and oranges. Let's talk about lung illnesses and the cytokine storms that, can, the cytokines that come and really wreak havoc on the body. This is not the same thing that we're discussing.
No, that's inflammation is kind of a tightrope, right? You need inflammation to heal. But so many times just in the world we live in, it gets so overblown that it becomes pathological, just like you're talking about.
Okay. So guys, I just want, this conversation that we're talking about are about muscle sprains and ligament injuries and stuff. This isn't about, inflammation in your kidneys or liver or lungs. Okay. So good. I'm glad to start there. Okay.
Because we definitely need to manage that.
Right. We have to manage that. But as far as, we talk about the inflammatory phase, that lasts about 5 to 10 days or so.
Yeah.
So if somebody twists their ankle, okay, you twist your ankle and it hurts to walk on it, what should they do?
So there's instead of rice, I use meat, and it stands for movement, exercise, analgesia, and treatment. So it's not like we can't treat that pain. That's inhumane, right? To just let somebody sit around with a horribly painful ankle. But one of the first, I mean, I'm going to get them some pain relievers on board. I'm probably going to use, something like turmeric, which I recognize has some anti-inflammatory components, but when I've used it for acute injury, I don't see it put the brakes on the healing process in the same way that a non-steroidal anti-inflammatory does. And I'm also going to use, proteolytic enzymes and herbs and things like that to help. But so that's actually the analgesia part of meat. But but I do want to encourage them to move that joint, but in a very gentle way, to start doing range of motion exercises that are always respectful of the person's pain level. Okay. Because I tell people, so for years and years, I did platelet-rich plasma injections and prolotherapy. So I'm depending on that inflammatory response to heal, those old injuries. So I've told people for years, with your movement, and then when you start adding in therapeutic exercise, if you get to the point where you're uncomfortable, it's probably okay. But if you cross the threshold where you're causing yourself pain, you're probably undoing some of your progress. So
Mhm.
The range of motion is always I think the therapeutic exercise, when you start being able to bear some weight, always respectful of pain.
Yeah, and we use pain management in order for people to get up and move, right? Or breathe properly. Let's just say if you have, broken ribs, you're not going to breathe, take deep breaths. And if you don't take deep breaths, and you can have pneumonia set in, and then that's a whole nother, issue that you can have. So we'll give pain management in order for people to get up and move. But it doesn't have to be narcotics, is what I'm hearing you say.
Yeah, definitely. I mean, in the natural world, we have a lot of tools at our disposal that you can take orally or you can put on topically to help, bring that pain down so you can move.
Yeah. And what are
And
some of those?
yeah, so I mentioned turmeric. I like proteolytic enzymes like serrapeptase and nattokinase. They tend to do a good job of relieving pain and helping sort of clean out old byproducts of inflammation that can, if you've got that chronic swelling in that ankle, you might want to get some of that stagnant inflammation to move along. But we can use, alternating hot and cold. We can use acupuncture. There's some really good topical pain patches that can be used with, I've had people use like Salonpas or lidocaine patches, and I have a Chinese herbal medicated one that's sort of my go-to.
Okay.
As long as their skin doesn't react to it, which happens just like 5% of the time.
Yeah.
Yeah.
So the Salonpas, I know I have that in my cabinet, and I'll use that. You can get that over the counter. And arnica is another one. I know
Yes.
when I was first introduced to arnica, not that long ago, just within the last few years, I thought it was for just helping the bruise to go away quicker. What is it used for?
So arnica is my go-to for any kind of trauma. So whether it's a sprained ankle or it's what I had my son take when he gave himself a pretty decent concussion recently. So, that kind of trauma. And it's even good for emotional trauma, but it is really good for bruising too, though, which is a result of trauma.
Yeah. Now, so would you ingest it? Would you rub it on?
Yes.
Both.
I would take it orally. You only want to take it orally in a homeopathic form. And you can put it on topically in a homeopathic form too. But like if you had an arnica tincture from the flower itself, you don't want to take that orally because there is some toxicity associated with it if you're not very careful with your dosing. And most people aren't going to have that level of training. But arnica, the whole, like, a tincture or a liniment, I have a liniment that I use, that can be put on topically and it works great for pain relief.
And is there, like, how many times a day would you put it on or take it?
I would put it on topically. I would put it on topically as often as it hurts.
Okay.
And if like for my son, the first day he had his concussion, I was having him take it every couple hours, just one or two of those little white pellets every couple hours. And then what I had him do was switch over to just taking it 3 times a day because I had him on a supplement regimen. And it was just, when people are concussed, you want to keep it as simple as possible. And so I was having him take that arnica with his other supplements just 3 times a day.
Okay. Yeah. I want to hear more on the second half of the show about what your plan of care, what his mechanism of injury was, and then what your plan of care was on that. But just to reiterate, movement is very important, and you do it to where maybe you're uncomfortable, but not in pain.
Yes.
Same with exercise. You want to, well, let's talk about that. Say you have a sprained ankle, you should just move on it as much as it's not painful for you, right?
Yeah.
Okay.
Yeah.
And then we talk about the pain medications and treatments. So that comprises MEAT, the acronym MEAT, movement, exercise, analgesia, and treatment.
Treatment.
So what is treatment?
Yeah, treatment is, it's also really broad. So it can be going to physical therapy and really doing those rehab exercises and, using some of the tools that they have at their disposal. It can be something like chiropractic treatment. Even massage therapy, can be really healing. I would do, when I had a brick and mortar practice, I did a lot of injections like prolotherapy and the platelet rich plasma to kind of get that healing process rolling again. So there's acupuncture is a twofer. It helps the pain and it will help the injury heal up more quickly. Yeah, but we have lots. And then I also think that part of treatment is just providing like the nutritional support for your connective tissue for your body to be able to lay down new collagen and healthy collagen. So, vitamin C and zinc and copper, and I'll usually have people either take some extra collagen or have them drink some bone broth every day too.
Oh, okay.
Yeah.
All right. And then I also remember reading about the hydrotherapy.
Yeah. Hydrotherapy is great. A lot of times I'll have people do contrast hydrotherapy where they, okay, sorry. I thought my computer was going to close down. Where they will, it's easiest with a wrist or an ankle, but you are basically putting the joint that's injured in hot water for 3 minutes, and then you switch to cold water for 30 seconds. And you do that 3 times. So 3 minutes, 30 seconds, 3 minutes, 30 seconds, 3 minutes, 30 seconds. And that's one treatment. And you're bringing in some good, healthy blood flow. And then you're flushing it out. And you're bringing in that blood flow and you're flushing it out. But the cold isn't on there long enough to really, it's not on there long enough to put the brakes on the inflammatory response.
Okay. So what my training is that cold ice on the affected joint for 24 hours, because after 24 hours it does nothing, and then you can it's more effective within the first 24 hours of an injury, and then you can start implementing heat like a heating pad. So we're saying alternate them both right away.
Yeah. And I will usually wait until the initial, I'll usually have people start contrast hydrotherapy at about the 48 to 72 hour mark, just so I just don't want to, you kind of want the swelling to be there because it means you're mounting a good response, but you don't want to encourage it to where you're starting to cut off blood flow. Because that's, it's one of the red flags you sort of look for with swelling, right? You want it to not get to the point where you're compressing vessels. So I do wait for a little bit to start doing the contrast.
Okay. So 24 to 72 hours or so.
Yeah. Yeah.
Okay. What about elevation? Do you, like on an ankle injury, would you want that to be elevated above the heart?
It can be. I don't, as far as rice goes, I don't have much of a problem with elevation because it can really be a lot more comfortable for the person if it's not, that throb you get. It's awful. And so elevating, it's fine.
Elevating is fine. And then what do you recommend for turmeric or curcumin? How much to take?
I'll usually have, it depends a little bit on the brand, but on most like higher quality over the counter, like I was able to get my son, I was having him take 1,000 milligrams 3 times a day.
Okay, of the curcumin. And do you know how much of the spice, like maybe if you're gonna cook, putting some spice on it, how much you would want to have that same type of effect?
I think you would need so much that you couldn't ingest that amount.
Yeah. And everything turns orange, right?
Yes.
Okay. No. And how do people find you?
I'm on Instagram, Dr. Amber Belt, Dr. Amber Belt. And then I'm on Facebook under the same name, except it's the Dr. period Amber Belt. And then I also have my website, which is dramberbelt.com.
Okay. And the Sages Arona, that's your site?
Yeah, sageserona.com. That's a company that my husband and I started, and we started it to make natural first aid kits for people. And yeah, and so now we have natural first aid kits. We have a boo-boo spray, which is a wound wash. And we have some herbal salves and things on there too.
Oh, that's great. I'm definitely
Yeah.
gonna peruse this in more detail, because I know a lot of our listeners are looking for first aid kits, but more
Mm-hmm.
natural. So,
Mm-hmm.
hey guys, it's sageserona.com. Okay, so check it out. That's SAGESIRONA.com. So that's great. Yeah, perfect. All right. Let's talk more about NSAIDs then. What they do in the body, the ibuprofen and Aleve. Why we don't want, you have an article here, and I'm going to put that in the show notes. Breaking the ice: how NSAIDs sustain the sick care system. Wow,
Yeah.
even just that title alone, I want to hear about it.
Yeah. So, by putting the brakes on that initial inflammatory response, I think that it puts us in a cycle of, or it doesn't allow that injury to heal completely. So I think that puts us in a cycle of chronic pain, and then that joint or ligament or tendon is going to be more vulnerable to being re-injured because that collagen healed all cross-hatched and weak and probably painful. And so it's just going to be a more vulnerable spot to re-injury. And then over time, you have to go in, and then you have to get the steroid injection. And then maybe you need other kinds of pain management. And then eventually, maybe you'll even need a joint replacement. So it kind of sets up this cycle where it does sustain that whole system there.
Mm. So let's say for someone that's listening that, say, has arthritis in their feet, and
Mm-hmm.
they're older, 60s, 70s, and it's starting to set in, and doctors are saying, oh well, hey, you can do an injection, and what are some of the alternatives for them to do? The turmeric, the hydrotherapy.
Mm-hmm. Yeah, a lot of the treatments would be the same. I've certainly done injections, the regenerative injections on plenty of arthritic feet and ankles, and they do tend to respond pretty well. We're never going to undo all that arthritis, but if we can get somebody to the point where they're walking without pain, that's fantastic, or with minimal pain.
Mm-hmm.
Yeah, but yeah, and I think too, just getting people's overall metabolism into a place where it's healthy and not promoting more inflammation in their body, getting their blood sugar to a good place. And just because I know, there's a jillion pre-diabetic folks out there that are just, that's going to predispose you to all that inflammation and all that pain.
Yeah, I tell people that all the time. I say, you know, imagine that you have big pipes, right? And then as that pipe goes out, it gets smaller and smaller and smaller. Well, that's the same with our vasculature. We have big pipes for our organs because our organs need them, but as it goes out to the feet or the hands or the eyes, it gets smaller and smaller. So if you're constantly maintaining a higher than higher level of blood sugar, blood is not supposed to necessarily be a lot of blood sugar is not sugar in the blood, sorry, is not supposed to be at high levels. And if
Mm-hmm.
it is, especially over time, it starts to erode those blood vessels. And that's why people start having pain, you know, in their toes, or numbness in their toes. And we start cutting off the toe, cutting off the foot, cutting off the calf, going up to above the knee, you know, or people start not being able to see well because, you know, blood flow is not going there the way it used to be. So I'm glad you brought up about, you know, looking at the whole person. And I think, you know, with naturopathy, it's more of a holistic approach to health.
Yeah. Yeah, definitely. We try to look at the person as a whole, and also really try to dig down and get to the root of what's causing them to feel terrible, or whatever is kind of feeding their, you know, their ailments. So we're trying to, we're trying to.
Yeah, we don't want to just mask symptoms. And, you know, we want to figure out what's causing it, and, you know, get to the root cause. And then obviously using therapeutics to help you live an active daily life. And, you know, guys, this is what we like to do here on Nurses Out Loud. We love to bring you education, as well as everybody on our America Out Loud platform. We have shows that are running 24/7. You could download the America Out Loud Talk Radio app, and, you know, click on that and hear a different show host speak on a different topic daily. And we also have our americaoutloud.shop, where our family of sponsors are giving you guys exclusive discounts available only to America Out Loud Talk Radio listeners. So make sure that you're checking it out and supporting, you know, our sponsors, and also supporting our shows by liking, reviewing, and sharing them with others. And we'll be right back after the break. Welcome back to Nurses Out Loud. I'm your host, Nurse Jodi Omalley. And today I have with me Dr. Amber Belt. We're discussing, well, she's a naturopathic doctor, and we're discussing alternative therapies to injuries. I'd like to start off this second half by, you know, for you telling us, like, what happened with your son? And then how did you treat that? Because I will say, you know, I don't think, you know, our brain, the research for our brain, you know, is as involved as it should be. And we clearly know, you know, based on other professional athletes, or even just, you know, athletes in general, that we never took seriously a concussion. And I like to say, you know, that when I describe it to my patients, I say, you know, our brain is soft, and it's surrounded by something hard, and that's our skull. And it has very limited ability to expand. And when it does expand, we have issues. Now, when you get, say, the lights knocked out of you, you know, that is that soft brain bumping up against the hard skull. And it's like a bruise. It's a bruise on the brain. Would you describe it that way?
Yeah. And I think it's a bruise on the brain with repercussions throughout the whole brain, because it's all neurons up there, right? So all of that electrical capacity to transmit gets jolted.
Yeah. And then you can hear ringing in your ears and all of that. Well, okay. So tell us what happened with your son.
So he had a mountain bike crash, and he lives on the West Coast, and he's in school. And so I get in middle of the night. Well, it felt like the middle of the night phone call, because I go to bed early, but and he'd had a crash, and he had friends with him, but he didn't really know what to do next. And so I got on a video call with him, and he had lacerations on his chin that clearly needed stitches. So, you know, I told that this is where I want him to access all the Western medicine he can.
Right.
But the first thing I noticed for him is he kept repeating himself. He would say his girlfriend's going to come pick him up. And he must have said that 6 or 7 times in our conversation. And I thought, well, that's either an adrenaline dump from having an accident, or he has a concussion. And then, I was kind of up all night with him via text and calls, and they did all the imaging and they got him sutured up, but talking to him the next day, it was pretty clear he had a concussion. So that is what happened.
Yeah. So whenever a patient comes in and say, I'm in triage, and they say, I fell and hit my head, we always assess level of consciousness. And that is, do you know where you are, the day, the time, the event? Do you remember it? Did you knock out? Is there a period of time that you fell that you don't remember? Are you nauseous? Are you vomiting? Those make it to where it's more of an emergency, right? That we look and we treat. So you want to talk about maybe the steps that you would ask to assess if somebody had a concussion or not?
Yeah, what I usually would do, and I was telling you earlier too, I played roller derby for a really long time. And so concussions weren't uncommon, or at least assessing someone for a concussion. So we would always use, well, at the time it was the SCAT-5 tool. So the sports concussion assessment tool. So I think if you're the parent of a kid who's in a contact sport, it's probably a good idea to print that. I think they have printable cards you can just print off and stick in your bag. So you just want to ask them, who they are, where they are, and just ask them some questions about orientation. I know, on the SCAT tool, we would ask, what sport were you playing? What half was it? Who won your last game? Just, questions to see if they knew what had happened sort of in the recent past, as well as what was happening right now.
Okay. And are you concerned if somebody were to knock out for a period of time?
Yeah, loss of consciousness is a red flag. They should go get assessed they should probably go get some imaging, or at least get assessed at the emergency room.
Yeah. And how about not being nauseous and vomiting?
Nausea, vomiting, definitely. I think double vision is a big one.
Yeah.
Obviously seizures, or if they have any visible deformity, those are all big red flags.
Right. So this SCAT-5, I just pulled it up. It is the Glasgow Coma Scale, the what you just described about, your level of consciousness. Do you remember? Cervical spine assessment. That we don't do that. We don't put everybody in a C collar like we used to do, because evidence comes out that you really need that. But it's really hard to educate older doctors on it, right? Oh, doc, we don't need to have them in a C spine for 12 hours,
Right.
And then, like you said, symptom evaluation. What are your symptoms? What's your cognitive ability? Neurological screening, balance examination, and then delayed recall. They had that. And I like to just say too that it's nice. My son's playing football for the first time this year. Not by any encouragement of my own, I will say. But he did have to undergo a very long learning module. I think it was about 90 minutes where they talked about that if you see your friend, get hit and they have any of those things that we talked about, you have got to tell someone, the coach, and let them know, even if they're like, no, I'm fine, because what are the benefits? What would happen if we didn't recognize a concussion and we allowed someone to keep, continuing on playing?
Yeah, I mean, they could get a second impact and have a that can be a disaster. Second impact syndrome, where, you know, you can have a lot of bleeding in the brain. And like you said, like there's not a lot of room for your brain to expand in your skull. And, you know, I don't think anybody wants a hole drilled in their head to alleviate that pressure. So if we can not go there, it's better. And I think too, just allowing the brain that time to heal, you know, we're finding that like and even mild traumatic brain injuries can be linked to ADHD and aggression and anxiety and all kinds of things, you know, mood wise that can affect us for the rest of our lives.
Yes, so it's very important that we allow the brain to heal. So if it's, you know, say a minor concussion, say a headache that people have, you know, they're sensitive to light, they don't want to talk, all of those things. What would you recommend for people to do to heal?
Yeah. So what I did, this is kind of, I'd say that my son's concussion was probably mild. He dealt with a little bit of a headache. So I put him on the turmeric that I had talked about and arnica. I also put him on pregnenolone, which is a hormone, and it's a neurosteroid. And our neurosteroids are going to be like progesterone, pregnenolone, and DHEA. And those are steroids that in the brain, they help modulate that inflammation, and they also really help with healing the brain. So I put him on pregnenolone.
Oh, I remember I got that from my doctor about a year. Well, she's a functional medicine doctor. Let me specify. Because I don't think any MD out there is going to give that. But yeah, so would you also recommend for them to not play for a certain amount of time?
Definitely. Yeah. And it depends, you know, I think my son's one of the hardest, he's pretty active, and one of the hardest things for him is he got bored and he really wanted to get back to the gym. So, you know, after he'd been pretty much symptom free for about 3 days, I told him he could, you know, do some body weight stuff, like do some push-ups, do some squats. If your symptoms are worse, you got to wait, you know, another couple days and then try it again. So you just have to, I know that certain sports have specific return to play protocols too. So like your son's football team, they might even have like, you can do this activity, and if your symptoms don't return, you can do this and that kind of thing. We had it in roller derby. Yeah, but I think it's important to go really slow with that. And again, to recognize that if your symptoms come back, just like with your sprained ankle or whatever, you're undoing some of the good that you've been doing healing.
Yeah, yeah. What about, we hear a lot of people say, oh, if you hit your head, you got to keep the person up. Don't let them go to sleep for 8 hours. What do you think about that?
It's outdated at this point, honestly. You just don't, I mean, you need to, if somebody loses consciousness, that's one thing, but sleep is a way for our brain to heal. So, you know, going home and waking them up every hour isn't contributing to their healing process. If they can't be roused, totally different, totally different scenario. But yeah, if somebody just needs to rest and sleep, that's fine.
Okay, so let's talk about that. Able to be aroused. You mean by, you know, we talk about it, do they respond to voice, to touch? You know, do you have to shake them? Let's talk about that. Like, what's the difference in their arousal?
Yeah, I think in that SCAT tool, I think they do a good job with the GCS where they give it a score. And I know for that tool, I think less than 12, if your GCS is less than 12, they recommend going to the hospital. So you can kind of go through that list as a guideline. So, you know, like you said, do they respond to questions? Can they respond to questions? You know, do they only respond to pain? Can they? Yeah. But if somebody is sleeping and you kind of shake them and they're like, go away, that's kind of normal. But if you shake them and there's nothing there, you probably should get them to the hospital.
Right. Like when she said, respond to voice, are they just responding? If you say, hey, Jeremy, 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 and then Jeremy opens his eyes and looks at you,
Yeah.
Versus having to do a sternal rub, and, rubbing their chest really hard, or, inflicting some pain to get them to, respond to you. So, yeah. So this child SCAT-5 assessment, they have the different types of assessment, and you can do an immediate on the field assessment. And that is double vision, weakness or tingling, burning in the arms or legs, severe or increasing headache. That one of the things that we ask someone when they say that I have a headache. I just had a patient the other day that came in and said, yeah, I deal with migraines, but this is the absolute worst headache of my life. When someone makes that statement and they're, pretty adamant about it, that is a red flag to us.
Yeah.
And I had a very healthy gentleman who experienced no trauma at all, have this increasing headache that he just couldn't shake. And he wasn't even used to having headaches. And so when he got to the point where he's like, this is the worst headache of my life, and he came into the emergency room, he did have a spontaneous brain bleed, and we had to fly him out. So that's a really important one. Seizure or convulsions, loss of consciousness, deteriorating conscious state. So that's saying like, hey, Jeremy, are you there? And he's like, yeah, I'm here. And then all of a sudden he starts drifting off to sleep or something. Vomiting, increasing restlessness, agitated or combative. And then they have other observable signs. Are they lying motionless on the field? When they do get up, is their balance off? Are they disoriented and talking about something completely, not appropriate? That their look, the look that they get, that blank stare, a facial injury. And then they go on to ask like memory assessment questions on here. And I can't go forward in this form without, completing it. But that's a very good tool. So thank you. Thank you for that. Appreciate that. I'll put this link in the show notes as well, and you guys can have access to that. And grandparents, anybody that's around children, I think it's important to understand the basics of a concussion. Do you think?
A few other supplements that I used for concussion specific symptoms, I used fish oils, so higher doses of EPA and DHA, just to help with that, modulate that inflammation. And there's this other really awesome supplement that I've used for years. It's called Cover 3. And it has turmeric and DHA and a couple other nutrients in it. And I will say that when my son, he recovered really quickly. I mean, he's 20, he's really healthy. He got on the supplements really fast. But he did notice another level up when he started taking that Cover 3, because it took a couple days to get to him because I had to have it shipped out to him. So yeah.
And I think, go ahead.
Oh, go ahead.
Well, I was talking about you said that he had lacerations and stuff on his face. So another question we'll ask in the emergency room was, did you break your fall, or was it, the ground that broke your fall? Meaning when that person, sometimes maybe in your son, he was on a bike and, he just crashed and then he hit himself. But sometimes with other people, they don't have a mechanism of injury. Let's say, I had a patient recently, he was an older man, just a couple of days ago, actually. He was 82 years old and he was standing heating up soup. when the next thing he knew, he was on the ground, and, and he just fell down. And that's where you have to work somebody up to say, well, why did you fall? Was it your heart, that made you fall? And he had a huge, like college size softball hematoma. So when he rolled into the emergency room and we saw that he had this big, essentially blood blister in a way, on his face, we're like, oh, this guy probably is going to have a bleed. And he did. And we had to send him out as well. But with your son having, the facial injuries, you did talk about some herbs and stuff that he used.
Yes. So I don't think he ever used, he might have used like a triple antibiotic ointment once, but I pretty quickly had him using, I don't know if you're familiar with Meta honey, and it's just a sterile medical grade honey. It's a Manuka honey.
Oh, yes.
And so, yeah, I had him put that, he had here, and then the deep lacerations here. So I had him using that, a couple times a day. And I think too, a lot of people, when they get a wound, they think I'm going to put calendula on it, which is it's a fantastic herb. It's antimicrobial. It helps with the proliferation and healing wounds. But you have to be careful with that one, because with deeper lacerations, it can cause the top to heal before the bottom. And that's not what we want. So for him, I didn't want him using that herb. So we went right to the Meta honey, and then just keeping it clean and I think other herbs I would have used though. I would have considered using like a tea tree salve. I would never have put tea tree oil on it straight, because that would have given him a chemical burn.
Okay.
But yeah, all those essential oils on open wounds, you don't want that. It'll burn. But a tea tree salve is nice and antimicrobial and would prevent all kinds of infections. So there's other things we could use.
Yeah, it's interesting you say about honey. There's one of the doctors on America Out Loud. I think it's Energetic Health Radio, but it's Dr. Janice Schmidt, and they call her the bee doctor, because she just says, bee pollen and, honey and everything. Like, what's your experience with honey? It's interesting you say to use it, because certainly we never use it in the hospital.
Right. And I have had great experience with it. The gnarliest wound I've ever seen in clinical practice was on the back of one of my patient's calves. And it started out small, and he didn't know how he got it. And then it just grew, and it was just a big old crater of a wound. And it had all of these weird microbes in it. So I don't know what happened for him to get it, but nothing was working, Western or naturopathic, until we started using honey on it. And that's finally what got it to turn the corner and heal. And he's fine now, but that's my best honey story.
Well, people talk about putting the triple antibiotic ointment. If their kid gets a scrape or abrasion or something, they're always wanting to do that, put the triple antibiotic ointment on them. And after I had seen many, many cases of necrotizing fasciitis, in the, just by somebody say, opening the door to get their groceries out and shutting the door with their elbow. And, they put this triple antibiotic ointment on it, and now they have this huge wound. And the lady, they actually had to cut her arm off because they just could not get it under control. And we have to be, and help me out here, but we have to know that there are so many different microbes out there, and you never know what's on something. And once you break your, largest protective barrier organ in our body, the skin, that opens the door for these to get in. And
Mm-hmm.
the one of the word I heard from the wound doctor to say that if you have a cut or a scrape, do not put anything on it, just wash it with soap and water.
Mm-hmm.
What are your thoughts on that?
I think that's fine. I
Mhm.
mean, I do think it can feel nice to have something on there to keep that wound from sort of cracking and opening back up. But even the dermatologists, they are hardly ever recommending triple antibiotic ointment anymore. And I think it's because, if I remember right, it was because they're seeing more allergic reactions to it.
Mm.
Yeah.
Yeah, that's interesting. Yeah, no, I hear you. I'm not, when I say that, I just want for the listeners that it's not saying that you can't put like a protective barrier on it, like a Vaseline gauze or something like that, so it doesn't get stuck. But the initial treatment should just be, cleaning it with soap and water and not putting peroxide and alcohol and all these other things on it, because you don't know what organism is in there and it's going to interact with. And in that case of the necrotizing fasciitis, I don't know, it was like a gram negative or a gram positive or something, and it interacted with her and did not serve her well. So I love hearing about the honey, and I am very interested in checking out your first aid alternative kits, because like I said, a lot of people want to not just have big pharma on hand. And if you know what to use and when to use it, certainly I think a lot of us listening now, in this day and age, are thinking like, yeah, I don't want to use big pharma stuff. I want to use what God gave us, and that's in nature. Big pharma just takes what it's in nature and manipulates it. Sometimes for good reasons, sometimes for bad reasons, in my opinion. So, well, thank you so much, Dr. Amber. I'm very impressed by you, and thank you for being on the show. Again, if you go to dramberbelt.com, that is going to link you with all of the stuff that we talked about, and her Substack articles and store and all of that. So, guys, I love bringing you different ways of thinking, really, just to educate you so you can choose what is right and best for you. We all have a risk benefit analysis that we do for every situation. All day long, we're doing risk benefit analysis, whether or not you realize it. And, it's just very important for us here on Nurses Out Loud to give you the tools and information to equip you and empower you to educate yourself. So until next time, friends, be safe, be well, and God bless.